she tracked like the man hours and everything. It was very well done. We do this community forum in some way, shape, or form. The November, December, the fall before each legislative session. It just gives us a great opportunity to really bring to light some of the issues facing particularly early childhood and maternal and child health issues. And obviously today's meeting went much broader than that. We've talked about senior issues. We've talked about illegal drug use in our county. We've talked about the medical reimbursement needs. We've talked about lots of things. So it's been a great meeting, I think. So I'm glad you were here, and we certainly welcome people's input and encourage people to be very involved in the process as the legislature gets into session. If there's something going on in Helena that you're concerned about, get involved.
In the past, we had about anywhere around 20, maybe in a year. That would be a high number. Usually it was somewhere between 12 and 15, 20 being a high number. This year, so far, I just asked Julie for an updated number, and we're not even done with the year. We have 52 communicable diseases that were people.
That's just chlamydia.
Just chlamydia, right.
Big on our needs assessment for early childhood in Richland County, and we've talked about it at the regional level, is child care. And we do not have an adequate amount of licensed or registered child care providers.
And one of the problems is not that we don't have the children, the need is there. I mean, I am licensed for 65 children. I have probably 131 on my books. I have a stack of waiting lists this long. I mean, people don't come. I mean, it's a fast turnover. The other problem that comes with that is hiring. That is my biggest issue. I am going to be losing 3 primary providers in my center in the next 4 months because of wages.
We're traveling around the state. I took the eastern swing here because I'm from eastern Montana, and we're visiting with the legislators and other local elected officials and local providers and the public, just to find out what their issues are around these general areas of health care, mainly public health care.
Though we talk about, suicide prevention for our youth and everything else, our elderly population is just as at risk.
Not really surprising, but since I've been in eastern Montana, all of the issues around the development here obviously are impacting you folks at a lot greater level than in other areas.
The entity is paying us something, but there's nothing that's put in funding for education purposes that could be used to help people learn what are potential signs of suicide, so that if they have a family member or coworker or other, peer at school or something, that they might